Okay, we are back for another live where we are answering questions. We're the Stabbed in the Back podcast. I got Andrew, who's with me from Sydney, and we'll just dive right into it. Let's see, just getting things set up on the actual Reddit. So the link is posted, and there will always be a replay on that YouTube. So if we just dive right into it, we're looking at a question. Let's see. Oh, orientation can't change once we've started, Andrew. It's all right. So trying to share my screen real quick. But while I do that, how are you doing this evening?
Yeah, I'm good. I think it's getting a
Cool.
bit warmer down in Australia. Summer's getting closer, winter's ending.
We are in the fall, but in South Carolina, it's still getting up to. Well, today will be 75. Actually, that's really nice. But there's some like tropical system coming up, and I don't know. There's going to bring in some rain, so I'm not really sure what's going on there. But anyhow, let's share. Got our screen here.
Yep.
So the question is basically this person's noticing that they have a really tight and firm, sort of palpable, I guess, um, like on one side. They don't have pain. They feel a little weaker and more cramped on one side. And when they push really deep, they feel soft, but other, like a hard, like, I don't want to say mass. It just, the person says, like, I'm hitting a wall and the other side feels soft. So they're essentially comparing their right side to their left side. And they're wondering, it's painless until they really get a lacrosse ball in there. And they've said it doesn't release the rock hardness. They sit for many hours a day and then cycling 1 to 2 hours a day. So no pain. That's a really good, that's a really good sign that there's probably not an issue. But there are a couple things that we want to tease out to try to not only answer this question, but make things a little bit helpful for people who notice certain things, maybe compared left to right side for their own back pain. So you can have pain and then go, my left side's different than my right. So there might be some nuggets that you'll get out of this conversation. So Andrew, like right off the bat, what do you want to tackle first? The differences side to side, the feeling of weakness, uh, like knowing how to release things or not release things and what that means.
Yeah, I feel like we can just start with like one of the very first sentences. Like one side of my back feels weaker slash more cramped than the other side.
Yeah. So, weakness is a perception, right? So just kind of, yeah, well, I guess if you could have an objective weakness, right? Then you have this feeling of weakness, and those are two different things.
Yeah. It's like if it is objective, then it's like are we comparing ourselves to something or ourselves, or are we comparing ourselves one side to the other? Or is it just a feeling?
Yeah. So it's interesting. It's like for me, just anecdotally talking real quick, is like I have a little bit of quad tendonitis, like when I lift, and I notice I can do a lot more on the right than I can do on the left.
Hmm.
Does that mean my left side's weaker?
Relative to or
Yeah, just relative to my right side. If I can objectively get 15 single leg box squats on my right, or heel taps, and then can only get about 8 where I'm starting to feel fatigue, objectively, technically, and there's presence of pain. Would you call, like, it's really hard? This is a tough question, actually. Is
yeah, this is a hard question.
Yeah. So what are your first thoughts?
S- I think in your case, if there is like pain as well, there might be differences because there could be some limitations due to how much pain you're feeling as well. That's like one of my little thoughts in my head. But if pain isn't limiting it, then yeah, sure. There's a rep difference there to see.
Yeah. So my thoughts are, if you know we can have stiffness driven by pain, as I think is like a protective mechanism, and then you can have like a coordination difference side to side. So pain can drive the nerves to sort of inhibit or make it feel like there's an endurance or issue, but it might actually be a more coordination problem. Um, so I find that interesting. So the thing that comes to my mind is, when do asymmetries or feeling weaker uh, on one side versus the other matter?
Yeah, then it always goes back to function, right? It's like, does this weakness stop you from doing anything in particular? If it's specifically, I want to get better at like single-legged box squats from a height, then sure, maybe this is something that we can specifically work on. But if you can do everything that you want to do, then maybe this difference doesn't matter as much. It's
Hmm.
like, what is the function of the difference that we're seeing here? Is there a function that we're trying to pick up on?
Right. So it's like this person says they're feeling weaker and more cramped in their side, but like in what context, right? So there's certain things that we're missing in order to be able to fully answer this question. But we can sort of, if I'm working with somebody who's got these same questions, which often I do, and I'm sure you do as well, I just sort of say, show me when it feels weaker, show me what positions, or what you're trying to do, which comes back to your point about being functional.
Yeah, so for him, it might be something cycling related because he says he cycles for like 1 to 2 hours every day. I was like, okay, sure, cool. Let's look into that and tell me a little bit more about how it's affecting you in that way.
Hmm. So it seems like it's stemming, like the issue is like, it feels weak on this side, so now I'm going to explore. So he pushes and compares side to side, and then he's saying, well, it's painless unless I get like a really firm hard object, which I used to be when I was in high school, which it ended up being side tangent. I used to play lacrosse in high school,
Okay,
and
cool.
I graduated in 2009, and I was talking to at the park. There's a bunch of dogs running around, and this girl had a lacrosse stick, and she was playing with her dad. And I was just casually talking to her, and I was like, "Oh, I used to be a goalie." She's like, "Oh, it's really cool." And I was like, "Yeah, I don't think I would ever join like a men's league now, because I had to build up a tolerance to getting smoked with the hard lacrosse ball."
Yep.
And through our conversation, was telling her when I graduated and how long ago, and I was like, "How long ago was that?" She was like, "It's 14 years." And I was like, "Oh, that." I was like, "Dang, that was like really quick." She's like, "Yeah, that's when I was born." And I was like, "Oh." Like, yeah, feeling pretty old. But yeah, so I don't miss those hard lacrosse balls, which is the point of the story. But like, we've got several things to unpack with laying on a hard lacrosse ball, whatever it is, not being released. So I think let's just talk about, like, when somebody explores side to side and finds what they think is an asymmetry, or even when a professional finds an asymmetry, what does that mean?
In like palpation or like quote unquote tightness or
Um, yeah, so I think asymmetries, just in general, people will naturally have them, and then they might
yeah.
wonder, I think, what that means. So if you were working with somebody and they said, I notice I can rotate more to my right than I can to the left, like, what does that
Mm.
mean? I'm trying to give you more context.
I think could mean quite a lot of things. It's just like your range is better on one side than the other. It's
Hmm.
like cool, but what's the function of that? I guess is
Hmm.
how I think about it. So if I play a sport and I'm used to, let's say, spiking, and I always turn to my right side, then
Hmm.
maybe it has some function there. It's like, okay, you're more flexible from turning with your right shoulder backwards there. That might be better for your sport to be quote unquote asymmetrical as well.
Yeah. So do asymmetries exist, like, naturally?
Yeah, for sure. Like from where some people are left and right handed already, right? So that's like
Yeah.
asymmetry, but it's normal as well. People
Yeah.
don't have different hand pains because they use one hand more or less than the other.
Yeah, for sure. I think in the rehab setting, when we look at asymmetries and we're trying to find someone's cause for pain, I think there is a belief that those asymmetries can be causative, but we find them so uh, naturally in asymptomatic populations. You start to wonder how much do they really matter, which is what is kind of like I'm trying to lead towards. And I think the common one is like an anterior pelvic tilt, and the percentage of people walking around with what a clinician or a rehab provider would look at visually with their eyeball and say, "Oh, you have back pain? Well, you have an anterior pelvic tilt, and that's your reason."
Yeah.
However, there is no accurate or gold standard way of measuring that in and across all rehab settings. So when lay people hear that, as is the reason I'm going over this, is that you're going to go see somebody and they're going to talk about your anterior pelvic tilt. And I'm telling you, there's no accurate or gold standard way to measure that. So you wonder, is this person just eyeballing this? And the truth, yeah, the answer is yes. I mean, they might put your hands on you, but there's no good way to measure it.
Yeah. I think people are built innately asymmetrical as well. It's like if we start talking about symmetry, it's like, okay, if we look inside our bodies, one side of our lungs we have like 3 lobes, and the other side we have 2, and like one side of our heart's shifted to like one side as well, and our stomach is kind of shifted weirdly to one side as well, and it all just becomes one nice, cool little fitting puzzle piece
Mm-hmm.
in our body there. So it's like all of this thing in our like upper body's entirely asymmetrical. So
Mm-hmm.
it's like, does symmetry really matter if like the insides of our bodies are like super different?
Where I find asymmetries matter the most would be post surgical.
Yeah.
And if you took, for example, somebody with an ACL injury and they've obviously had a lot of deconditioning and atrophy of their surgical side as opposed to their intact side, that's when you go, we need to get this quad as close to the other side as we can as we're rehabbing and then layering on functional things or whatever you're trying to do, whether it's sport or just kind of get back. But that's when you would want to be like, hey, this asymmetry matters. I need to address it. In the uh, original poster, you know, it's painless unless you push on it. I don't know, Andrew, if you've been to a therapist where nothing hurts until they dig
I feel like they
into
can always find a pressure point that hurts.
yeah, yeah, for
Yeah.
sure. I had a patient one time who was like, "Yeah, it hurts right here in my neck," and she literally grabbed my shoulder and just dug into it, and I was like, "Yeah,
That
that
hurts me as well.
like ow." So you have to be careful. I think when you hear narratives, that's kind of why we harp on this. When you hear narratives that, if you really just objectively step back and you go, you know, is this a normal thing, and is what they're telling me, how does it make me feel? Does it make me feel empowered, or is it making me feel weaker and more fragile? I think that's really hard for a person who's seeking help to be in a situation where they're hearing uh, supposed narratives from a professional, and it's hard to take yourself out of that position. So next time you are at your massage therapist and they're talking about how tight your fascia is on one side, those structures are meant to be tight. I mean, there are things about your body that are resilient, and you can push on them and they're going to push back. We're not as fragile as we sometimes feel we are, which is hard concept to grasp, especially when we are feeling weak or we have perceptions of weakness or miscoordination.
Yeah. Yeah, I think another thing is like lots of people can say one thing feels tight, but it always comes back down to, it's like, does it matter if it's tight in the first place? Like for me, right? If I go to get a massage or whatever, and they massage my traps, a lot of the time, or like 100% of the time so far, they've all said that I have really tight traps, but
Hmm.
like I don't have any problems with like I don't have any shoulder issues. It's like maybe this tightness isn't a problem at all.
Right.
And it's like these people just feel it from like their own point of view. But if it's not affecting me in any way, then it's like, yeah, it doesn't matter to me if I have quote unquote tight traps. It's like, these are my traps, man. They've just been that way. So
Um, I'm gonna share a example of when asymmetries, you know, might not really matter as much. So we're not going to play with sound, but this here is Clay Stevens. He's an Australian gymnast, and he was born without a pec muscle. He competed at the Olympics, so there's a picture there. He clearly is fit. He's
Yeah,
kind
it's
of looks
Jack, man.
like me. No, I'm just kidding. But he is got no issues competing not only in his sport, but you know, I always come to his story because it's like, all right, this guy born without a pec, one of an asymmetry that is like obviously
It's,
you can see it, but it's not really impacting him functionally. So you kind of wonder,
yeah,
oh look, Finding Nemo. That's
that's cute.
that is that is cute. So I like to teach in stories um, to try to combat some misinformation. It's like, well, if this guy is, clearly is overcoming a genetic condition, is it really that big of a deal for some of these other things?
Yeah, for sure. And I think the more we gather like stories or examples of people with asymmetry, quote unquote asymmetries,
Hmm.
and they don't have problems, it's like, oh, that's pretty cool to see. It's like this problem, this person has quote unquote a problem, but they can function completely fine and have
Hmm.
no pain or of really top high tier performers. It's like these guys are still amazing.
Hmm.
And like in the Olympics, you see people with who are amazing sprinters and they only have like one quote unquote leg, right? And they have the other one that's artificial.
Yeah. I mean, just looking at Paralympic in
Yeah,
general.
dude, Paralympics is really cool to see. It's like these
Yeah.
people are way better than me in like whatever sport they do, and
Hmm.
they're literally missing limbs.
If we come back to the question, moving on to another kind of topic is rolling on a lacrosse ball, and the original poster is talking about how it hasn't released. So it's this idea that prolonged pressure into potentially a knot and it sort of releasing being a treatment. And when that release happens, supposedly
That we're
relief.
fixed. Yeah,
Yeah. So my first thought comes to how reliably can not just yourself, right, but a practitioner who's working with you, how reliably from practitioner to practitioner can you palpate and identify these quote unquote knots? And the short answer is it's really bad. Like, studies have shown between the inter-rater reliability is what it's called, that person A versus person B can't even identify the same knot supposedly. So you have to wonder, okay, if we can't identify it, and also the community at large can't even accurately describe the mechanism for these knots because I think we just don't really know, then are they really something that needs to be treated? And can we? I mean, can we treat them? So there's a potentially a reason why you haven't felt a release is maybe you can't get one, and we don't even know what you're digging into. So it's not necessarily your fault. I think it's just like a innate thing to do, is like if we feel sore to put pressure through something, which if you're having pain, we can talk a little bit about why feeling any type of pressure feels better than the baseline amount of pain that you're having. And there's mechanism of just kind of this idea that, well, this is something a new and novel stimulus, so it kind of a hurts so good feeling, and then you get some short-term relief because it's not the same and your system's sort of processing it, and then a couple days later, or that later that day even, the original pain can come back. If you've had that experience, that might explain why it's your system accepting a novel experience and really, I guess you could say, enjoying something different than what it's kind of been experiencing lately.
yeah, yeah. And sometimes when somebody's like pushing on it or massaging it, and it does feel good at the time, they're like, "Oh, you have the idea that they're physically fixing you."
Hmm.
That belief can be can be a really positive experience as well. It's like, "Oh, this person's actually helping me right now and working on whatever I'm feeling, tightness or whatever," and that can be relieving, which is yeah, can help in the short term for sure. And you just kind of calm down and everything. It's like, oh, I feel safer because somebody's working on me, and now I feel like I'm taking a step in the right direction. So now I'm more calm and everything. The whole body just starts to feel better as well.
Mm-hmm. So there's kind of this, if we identify knots as this bundle of tissue that is quote unquote angry, right? Because it's sensitive. Like if you find the knot, push on it, it hurts. You could make the argument that there's something not like the area is just not happy. And the kind of story I like to tell people is if you had a really close friend that was really grumpy and upset about something and their arms were crossed and you wanted them to feel better, which approach sounds better? The one where you come up to them and grab them by the arms and you try to pry them apart and you just tell them, hey man, feel better. Just, and you trying to just wrestle them, right? That's how I feel like digging a lacrosse ball into a sensitive area is. Instead, you want to approach it like a very like calm, relaxing, like everything will be okay. So that's, you know, why I tell people if they're going to go get a massage for pain, really make sure that it feels gentle and it feels good because you're going to respond probably a little bit better than the it hurts so good deep tissue massage. I don't know if you have thoughts on that, Andrew.
I think I do. I think I'm on this fence of like, if it feels better in the moment, it generally feels, if it just feels better, right? So
Mm-hmm.
it's like if doing soft tissue, quote unquote, soft tissue massages are better than like deep tissue massage, which like causes more pain, then maybe we can lean more onto like the soft tissue massages if that's what you want to do for treatment.
But what if somebody's trying to break up scar tissue and they're trying to deform your fascia?
Oh.
I'm giving you a lot of bait.
It's like, what does that mean in the first place? It's like,
Mm-hmm.
can we even do that? It's like, is that measurable? I think right now the research kind of says that we need like a butt ton of force to like actually create these changes and stuff that people are telling others.
Mm-hmm. So we think about what can our hands actually do to somebody's body. I don't think that they are not helpful. I don't think these approaches are something that we should just write off. I just think that the narratives that come with it, like, hey, I'm breaking up scar tissue. I'm not totally sure, as Andrew's pointing out, the literature supports that that's actually what's happening. I'm pretty sure. Like I should talk about a little bit more confidence. I think I'm tiptoeing around trying not to hurt anybody's feelings who enjoy going to get massage. But the truth is, you're interacting with very little structures underneath the skin. I mean, you can only push so deep before you can feel bone, right? But we're talking 9-10 millimeters deep of how far you can palpate certain structures, which is not very deep. So, for us to be able to say that we can accurately press on one area, that we can accurately intervene is, I think it's less specific and more of a global interaction. And if it feels good at the end of the day and you are improving, it doesn't matter. But if you're somebody that's like, the reason we're harping on this is if you're someone who's spending money and so much time and effort for treatments that are promised to get rid of and like solve issues, but they're not, no pun intended, not, then it's time to just reevaluate, which is what I tell people. Just reevaluate it, step back and be like, well, actually, is this helping? Because I've been told it's supposed to. Not sure it is.
Yeah. I think I bumped into a graphic that's like pretty cool to see.
Okay.
You might need to give me a few minutes to find it though.
That's fine.
But pretty much the pyramid shows the the order of importance of what type of treatments we should
Mm.
be expecting slash are probably more beneficial for us
Mm-hmm.
compared to others. Hmm. Okay, here
While
it
you,
is.
oh, you found it.
Yep. Is it this one?
While you're looking at it, I was just gonna come back to the Reddit question, which is it hasn't released, and I think hopefully the point that I was getting across is that it might not release, and maybe it doesn't need to, right? Especially for this particular person who's like, I'm not experiencing pain unless I push really hard on it. You know, if you're that worried about it, maybe get it checked out by a doctor, a physician that can palpate it themselves and give you that sort of relief that you really shouldn't be worrying about this. But if you're not having any symptoms, then it's probably not that big of an issue. So I do appreciate this question because I think there are a lot of people who have pain and then will have these questions. And like I was telling Andrew before we went live, I had, joints make noises naturally. And when I started having this knee pain that I mentioned at the beginning of the live, I noticed my knee started to make noise. And I now, even as a practitioner, as a physical therapist, knowing and experiencing working with people, I even myself start to go, whoa, like I wonder if this joint noise was there before. And it probably was because joints are meant to make noises. The bubbles form when the surfaces start to separate, which creates a vacuum. That cavitation, as it's called, will pop. It's often the pop that you hear with manipulations of the spine in chiropractic care or physical therapy care, physio. And then sometimes you get tendons or ligaments moving around bones. You'll get like a snapping feeling. So anytime I talk about joint noises with somebody, when I tell them it matters if you had acute trauma followed by swelling and bruising and pain that doesn't really let up for the first like day or two. That's when you go, okay, maybe I damaged something. But if you're like, oh, knuckles popping, even not really a big deal. Did you find it?
Yeah, so I sent you a link to it, and you can just blow up the picture. So the top comment
All
of
right.
the link is actually the our expectations are just the pyramid in reverse. Yeah, as you can see over there as
We'll
well.
zoom in. Our expectations, meaning
So if you scroll
the
down, the very first comment, it's like, the second comment for you. Our patients'
good concept.
expectations and therefore the failure of the pyramid. It's like
Oh, I see what
that's what people expect. They expect the pyramid to be upside down.
yeah, right.
But
Yeah. So just breaking it down, the ones that we're kind of harping on again, it's not that you can't rely on these things. It's just the
yeah,
narratives that come with it. And these are great entry points for a lot of people, but they should also include many of the treatment options here. It's graded exposure, graded activity. So as when we talk about progressive activities, getting back to the things that you're trying to do, but right in a regressed fashion or progressed fashion. So you're starting off with like low load, 2 legs, those things like that, making sure that they have reassurance in this blue area right here. Um, that you're making sure that we're trying to address those fears, which can be debunking certain myths and old narratives that deem actually to be more harmful. And then the last one is just making sure that the person, it's the therapeutic alliance that you are. This is a pyramid, I think, from the perspective of a clinician. So, um, right, Andrew, is that what you're trying to explain?
yeah, it's
Yeah.
mainly for clinicians because like there's so much jargon on the pyramid.
Mm-hmm.
But even for like the layperson, it's like, I shouldn't be only focusing on massage,
Mm-hmm.
which is like at the very top. It's like the clinician's meant to be
Mm-hmm.
teaching me and telling me about how I think about certain things, and they should explain to me if it's wrong or right, or if it's positive or negative to my life or whatever as well. It's like,
Yeah.
is this building me up or is it actually tearing me down?
I think this could be if you're watching this and you're looking at this pyramid and we said, oh, it's for physios or PTs and other rehab providers. What Andrew's saying is you can take away from it is essentially, am I only getting the stuff at the top of the pyramid, or like am I actually getting good education that helps reassure my situation, and that doesn't make me more fearful, which is in the blue. And then am I experiencing things in the orange, like, and then the green is making sure that the essentially the
You're not missing
clinician.
anything. Yeah.
Yeah, is yeah, exactly. So
It's like we're not missing any red flags or anything that's dangerous or anything that's more urgent.
mhm,
Yeah. So that's like for the physio or the professional to double check and ask you
mhm,
questions about what symptoms are you feeling and whatever. It's
mhm.
like, do you have a history of cancer or whatnot? Yeah.
Cool, Andrew. I think we did a pretty good job of diving into the kind of the nuances of this question. It really, the reason we picked it again is it teased out probably 3 or 4 different myths, or misunderstanding, misinformation, old bad narratives. There's a lot of what's called iatrogenic uh, context when people are going to get care, something either done to them or said to them creates more harm and more sensitivity. So by talking about these narratives, we're trying to share with people the reverse, I guess. It's like that, hey, we are robust animals, beings that can overcome certain conditions. The human body does heal very well, even though it doesn't feel like it. And back pain is a bitch, but we can overcome with the kind of the right step forward. And I think that starts with the positive mindset, honestly, and just not being fearful.
Yeah. Yeah, it's really hard to grasp that, especially if we have so much evidence in the current moment, feeling like we're so fragile and everything's just falling apart.
Mm-hmm.
Yeah, that's the most difficult part about the journey.
All right. Well, one of these days we'll get someone popping in that has a question. I've been peeking at the chat. I don't really see anything today, which is not a big deal. But if you're still watching, we will be, unless we say otherwise, going live between 8 and 9 Eastern on Reddit or on YouTube. We'll be posting the YouTube link. So if you guys have questions ahead of time that you want to answer, you can just send a message to the moderator group, or a direct message on Reddit, or reach out to us through Instagram or YouTube or anything like that. So other than that, if you also are somebody that's overcome back pain, or somebody who's had a successful experience overcoming back pain and you think their experience would be helpful for others to hear, the Stabbed in the Back podcast is about sharing experiences that give other people hope that it is possible to overcome their situation. So please